all this snow, streets and sidewalks are very slippery. 'Tis the season for falls and fractures.
Each year we see more patients due to fall, mainly in regard to the ice issue of the sidewalks. It seems that the last couple of years it's more of a problem. I don't know exactly why, but it is the falls that we see in younger people, but mainly in more older patients. And the fractures we see during that period are, in my view, more serious than what we used to see before because of the ice. The most common is still simple fractures, and we see a lot of wrist fractures. We may see ankle fracture, but we also see hip fractures. So we see a whole gamut from the least serious to the very serious falls consequences. Hip fracture is, some of them have to have surgery, so there's the operating room, there's a stay in the hospital, there is after some rehab. It's a much longer process, mainly for elderly people. And for the people who have very complex consequences, like a head trauma patient, this may be much longer.
People need to move the injured area. Ice is used when there's a lot of pain or swelling. Elevation is always something we use. In case of ankle fractures, we'll teach them how to walk again. Initially at first, they'll be partial weight bearing, which means they can only put like 50% of their weight. And progressively, as the orthopedic surgeon says go, then what we do is add weight. Ultimately, we get rid of the crutches and in some cases the walker towards a normal walking pattern. Yes, a simple wrist fracture, we'll see them once or twice. The mobility is great. Take a fracture of the wrist that ended up with surgery, then unfortunately we could be looking at months. We will not see them every day. We might see them once a week. We will modify, adapt the program to how fast they're progressing. But yes, we might unfortunately have to see them for months to make sure they become functional once again.
You really need to be very careful at this time of year. If it's possible for you, stay inside while the conditions are a bit like this today. Carl Thériault for Centre-Ouest Central TV.